Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 NCLEX-RN nursing examination multiple choice questions and answers. Read the question by yourself and find the correct answer. Let's begin.
356. A nurse in the newborn nursery is planning for the admission of a large for gestational age, LGA, infant. In preparing to care for this infant, the nurse obtains equipment to perform which diagnostic test? 1. Serum insulin level. 2. Heel stick blood glucose. 3. RH and ABO blood typing. 4. Indirect and direct bilirubin levels. Answer: 2. Rationale. After birth, the most common problem in the LGA infant is hyperglycemia, especially if the mother is diabetic. At delivery, when the umbilical cord is clamped and cut, maternal blood glucose supply is lost. The newborn continues to produce large amounts of insulin, which depletes the infant's blood glucose within the first hours after birth. If immediate identification and treatment of hyperglycemia are not performed, the newborn may suffer central nervous system damage caused by inadequate circulation of glucose to the brain. Serum insulin levels are not helpful, because there is no intervention to decrease these levels to prevent hyperglycemia. There is no rationale for prescribing an RH and ABO blood type unless the maternal blood type is O or Rh negative. Indirect and direct bilirubin levels are usually prescribed after the first 24 hours, because jaundice is usually seen at 48 to 72 hours after birth. 357. The nurse caring for a client receiving intravenous therapy monitors for which signs of infiltration at the catheter site of an intravenous. 4. Infusion. Select all that apply. 1. Slowing of the forate. 2. Tenderness at the insertion site. 3. Edema around the insertion site. 4. Skin tightness at the insertion site. 5. Warmth of skin at the insertion site. 6. Fluid leaking from the insertion site. Answer: 1, 2, 3, 4, 6. Rationale. Infiltration is the leakage of N4 solution into the extravascular tissue. Signs and symptoms include slowing of the forate, increasing edema in or around the catheter insertion site, complaints of skin tightness, burning, tenderness, or general discomfort at the insertion site, blanching or coolness of the skin, and fluid leaking from the insertion site. 358. A client receiving parenteral nutrition, PN, through a subclavian catheter suddenly develops dyspnea, tachycardia, cyanosis, and decreased level of consciousness. Based on these findings, which is the best intervention for the nurse to implement for the client? 1. Turn the client to his or her left side in Trendelenburg's position. 2. Obtain a stat oxygen saturation level. 3. Examine the insertion site for redness. 4. Perform a stat fingerstick glucose level. Answer: 1. Rationale. Clinical indicators of air embolism include chest pain, tachycardia, dyspnea, anxiety, feelings of impending doom, cyanosis, and hypertension. Positioning the client in Trendelenburg's and on the left side helps to isolate the air embolism in the right atrium and prevent a thromboembolic event in a vital organ. Monitoring the oxygen saturation is a reasonable nursing response to the client's condition. However, acting to prevent deterioration in the client's condition is more important than obtaining additional client data. Options 3 and 4 are unrelated to the symptoms identified in the question. 359. A client has a total serum calcium level of 7.5 mg/dl. Which clinical manifestations would the nurse expect to note on assessment of the client? Select all that apply. 1. Constipation. 2. Muscle twitches. 3. Hypoactive bowel sounds. 4. Hyperactive deep tendon reflexes. 5. Positive Trousseau's sign and positive Kvostek's sign. 6. Prolonged street interval and QT interval on electrocardiogram, ECG. Answer: 2, 4, 5, 6. Rationale. Hypocalcemia is a total serum calcium level less than 9.0 mg/dl. Clinical manifestations of hypocalcemia include decreased heart rate, diminished peripheral pulses, hypertension, and prolonged ST interval and QT interval on ECG. Neuromuscular manifestations include anxiety and irritability, paresthesia followed by numbness, muscle twitches, cramps, tetany, and seizures, hyperactive deep tendon reflexes, and positive Trousseau's and Kvostok's signs. Gastrointestinal manifestations include increased gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. 360. A client is experiencing acute cardiac and cerebral symptoms as a result of an excess fluid volume. The nurse should implement which of the following measures to increase the client's comfort until specific therapy is prescribed by the physician? 1. Measure urine output on an hourly basis. 2. Measure intravenous and oral fluid intake. 3. Elevate the client's head to at least 45 degrees. 4. Administer oxygen at 4 liters per minute by nasal cannula. Answer: 3. Rationale: elevating the head of the bed to 45 degrees decreases venous return to the heart from the lower body, thus reducing the volume of blood that has to be pumped by the heart. It also promotes venous drainage from the brain, reducing cerebral symptoms. Intake and output should be monitored and recorded to provide current information about the client's volume status, but this measure will not increase the client's comfort. Oxygen is a medication and is not administered without a prescription to do so. Options 1, 2, and 4 are important measures, although they do not improve the client's comfort. 361. The nurse develops a discharge plan for a client who had a total abdominal hysterectomy. The nurse should include which activity instructions in the plan? Select all that apply. 1. Avoid heavy lifting. 2. Sit as much as possible. 3. Take baths rather than showers. 4. Limit stair climbing to 5 times a day. 5. Gradually increase walking as exercise but stop before becoming fatigued. 6. Avoid jogging, aerobic exercises, sports, or any strenuous exercise for 6 weeks. Answer: 1, 4, 5, 6. Rationale: after a total abdominal hysterectomy, the client should limit stair climbing to 5 times a day. The client should also take showers rather than tub baths. Additional instructions include avoiding lifting anything that is heavy, walking indoors for the first week and then gradually increasing walking as exercise, but stopping before becoming fatigued, avoiding the sitting position for extended periods, avoiding crossing the legs at the knees, avoiding jogging, aerobic exercises, sports, or any strenuous exercise for 6 weeks, and avoiding driving for at least 4 weeks or until the surgeon has given permission to do so. 362. The nurse has a prescription to ambulate a client with a nephrostomy tube in the hole 4 times a day. The nurse determines that the safest way to accomplish this while maintaining the integrity of the nephrostomy tube is to 1. Change the drainage bag to a leg collection bag. 2. Tie the drainage bag to the client's waist while ambulating. 3. Use a walker to hang the drainage bag from while ambulating. 4. Tell the client to hold the drainage bag higher than the level of the bladder. Answer: 1. Rationale: the safest approach to protect the integrity and safety of the nephrostomy tube with a mobile client is to attach the tube to a leg collection bag. This allows for greater freedom of movement, while preventing accidental disconnection or dislodgement. The drainage bag is kept below the level of the bladder. Option 3 presents the risk of tension or pulling on the nephrostomy tube by the client during ambulation. 364. A nurse is developing a plan of care for a client who has returned to the nursing unit after left nephrectomy. The nurse should include which assessments in the plan of care? Select all that apply. 1. Pain level. 2. Vital signs. 3. Hourly urine output. 4. Tolerance for sips of clear liquids. 5. Ability to cough and deep breathe. Answer: 1, 2, 3, 5. Rationale. After nephrectomy, it is imperative to measure the urine output on an hourly basis. This is done to monitor the effectiveness of the remaining kidney and detect renal failure early, if it should occur. The client may also experience significant pain after this surgery, which could affect the client's ability to reposition, cough, and deep breathe. Therefore, the next most important measurements are vital signs, pain level, and bed mobility. Clear liquids are not given until the client has bowel sounds. 365. The nurse instructs a mother of a child who had a plaster cast applied to the arm about measures that will help the cast dry. Which instructions should the nurse provide to the mother? Select all that apply. 1. Lift the cast using the fingertips. 2. Place the child on a firm mattress. 3. Direct a fan toward the cast to facilitate drying. 4. Support the cast and adjacent joints with pillows. 5. Place the extremity with the cast in a dependent position. 6. Reposition the extremity with the cast every 2 to 4 hours. Answer: 2, 3, 4, 6. Rationale: to help the cast dry, the child should be placed on a firm mattress. A fan may be directed toward the cast to facilitate drying. Once the cast is dry, the cast should sound hollow and be cool to touch. The cast and adjacent joints should be elevated and supported with pillows. To ensure thorough drying, the extremity with the cast should be repositioned every 2 to 4 hours. The cast is lifted by using the palms of the hands, not the fingertips, to prevent indentation in the wet cast surface. Indentations could possibly cause pressure on the skin under the cast. 368. It has been 12 hours since the client's delivery of a newborn. The nurse assesses the client for the process of involution and documents that it is progressing normally when palpation of the client's fundus is noted. 1. At the level of the umbilicus. 2. 1 finger breadth below the umbilicus. 3. 2 finger breadths below the umbilicus. 4. Midway between the umbilicus and the symphysis pubis. Answer: 1. Rationale: the term involution is used to describe the rapid reduction in size and the return of the uterus to a normal condition similar to its non-pregnant state. Immediately after the delivery of the placenta, the uterus contracts to the size of a large grapefruit. The fundus is situated in the midline between the symphysis pubis and the umbilicus. Within 6 to 12 hours after birth, the fundus of the uterus rises to the level of the umbilicus. The top of the fundus remains at the level of the umbilicus for about a day and then descends into the pelvis approximately 1 finger breadth on each succeeding day. 369. A client with a gastric tumor is scheduled for a subtotal gastrectomy, Billroth 2 procedure. The nurse explains the procedure to the client and tells the client that their 1 proximal end of the distal stomach is anastomosed to the duodenum. 2 entire stomach is removed and the esophagus is anastomosed to the duodenum. 3 lower portion of the stomach is removed and the remainder is anastomosed to the jejunum. 4 antrum of the stomach is removed and the remaining portion is anastomosed to the duodenum. Answer: 3. Rationale: in the Billroth 2 procedure, the lower portion of the stomach is removed and the remainder is anastomosed to the jejunum. The duodenal stump is preserved to permit bile flow to the jejunum. Options 1, 2, and 4 are incorrect descriptions. 370. A client with diabetes mellitus receives Humulin regular insulin 8 units subcutaneously at 7:30 a.m. The nurse would be most alert to signs of hyperglycemia at what time during the day? 1. 9:30 a.m. to 11:30 a.m. 2. 11:30 a.m. to 1:30 p.m. 3. 1:30 p.m. to 3:30 p.m. 4. 3:30 p.m. to 5:30 p.m. Answer: 1. Rationale: Humulin regular insulin is a short-acting insulin. Its onset of action occurs in a half hour and peaks in 2 to 4 hours. Its duration of action is 4 to 6 hours. A hyperglycemic reaction will most likely occur at peak time, which in this situation is between 9:30 am and 11:30 am. 371. A nurse develops a post-operative plan of care for a client scheduled for hypophysectomy. Which interventions should be included in the plan of care? Select all that apply. 1. Obtain daily weights. 2. Monitor intake and output. 3. Elevate the head of the bed. 4. Use a soft toothbrush for mouth care. 5. Encourage coughing and deep breathing. Answer: 1, 2, 3. Rationale: a hypophysectomy is done to remove a pituitary tumor. Because temporary diabetes insipidus or syndrome of inappropriate antidiuretic hormone can develop after this surgery, obtaining daily weights and monitoring intake and output are important interventions. The head of the bed is elevated to assist in preventing increased intracranial pressure. Toothbrushing, sneezing, coughing, nose blowing, and bending are activities that should be avoided post-operatively in the client who underwent a hypophysectomy because of the risk of increasing intracranial pressure. These activities interfere with the healing of the incision and can disrupt the graft. 372. A client undergoes a thyroidectomy and the nurse monitors the client for signs of damage to the parathyroid glands post-operatively. Which of the following findings indicate damage to the parathyroid glands? 1. Fever. 2. Neck pain. 3. Hoarseness. 4. Tingling around the mouth. Answer: 4. Rationale: the parathyroid glands can be damaged or their blood supply impaired during thyroid surgery. Hypocalcemia and tetany result when parathyroid hormone, PTH, levels decrease. The nurse monitors for complaints of tingling around the mouth or of the toes or fingers and muscular twitching because these are signs of calcium deficiency. Additional later signs of hypocalcemia are positive Gvostek's and Trousseau's signs. Fever may be expected in the immediate postoperative period but is not an indication of damage to the parathyroid glands. However, if a fever persists, the physician is notified. Neck pain and hoarseness are expected findings post-operatively. 374. A nurse teaches a postpartum client about observation of lochia. The nurse determines the client's understanding when the client says that on the second day postpartum, the lochia should be 1. Red, 2. Pink, 3. White, 4. Yellow. Answer: 1. Rationale: the uterus rids itself of the debris that remains after birth through a discharge called lochia, which is classified according to its appearance and contents. Lochia rubra is dark red in color. It occurs from delivery to 3 days postpartum and contains epithelial cells, erythrocytes, leukocytes, shreds of decidua, and occasionally fetal meconium, lanugo, and vernix caseosa. Lochia serosa is a brownish-pink discharge that occurs from days 4 to 10. Lochia alba is a white discharge that occurs from days 10 to 14. Lochia should not be yellow in color or contain large clots. If it does, the cause should be investigated without delay. 375. The nurse develops a care plan for a client receiving hemodialysis who has an arteriovenous avenue fistula in the right arm. The nurse includes which interventions in the plan to ensure protecting the avenue fistula? Select all that apply. 1. Assess pulses and circulation proximal to the fistula. 2. Palpate for thrills and auscultate for a bruit every 4 hours. 3. Check for bleeding and infection at hemodialysis needle insertion sites. 4. Avoid taking blood pressure or performing venipunctures in the extremity. 5. Instruct the client not to carry heavy objects or anything that compresses the extremity. 6. Instruct the client not to sleep in a position that places his or her body weight on top of the extremity. Answer: 2, 3, 4, 5, 6. Rationale: an avenue fistula is an internal anastomosis of an artery to a vein and is used as an access for hemodialysis. The nurse should implement the following to protect the fistula: avoid taking blood pressures or performing venipunctures in the extremity, palpate for thrills and auscultate for a bruit every 4 hours, Assess pulses and circulation distal to the fistula. Check for bleeding and infection at hemodialysis needle insertion sites. Instruct the client not to carry heavy objects or anything that compresses the extremity, and instruct the client not to sleep in a position that places his or her body weight on top of the extremity. 376. A nurse is performing an admission assessment on a newborn infant admitted to the nursery with the diagnosis of subdural hematoma after a difficult vaginal delivery. The nurse should do which of the following to assess for major symptoms associated with subdural hematoma? 1. Monitor the urine for blood. 2. Monitor the urinary output pattern. 3. Test for contractures of the extremities. 4. Test for equality of extremities when stimulating reflexes. Answer: 4. Rationale. A subdural hematoma can cause pressure on a specific area of the cerebral tissue. This can cause changes in the stimuli responses in the extremities on the opposite side of the body, especially if the infant is actively bleeding. Options 1 and 2 are incorrect. After delivery, an infant would normally be incontinent of urine. Blood in the urine would indicate abdominal trauma and would not be a result of the hematoma. Option 3 is incorrect because contractures would not occur this soon after delivery. 377. A client has received atropine sulfate preoperatively. The nurse monitors the client for which of the following effects of the medication in the immediate postoperative period? 1. Diarrhea. 2. Bradycardia. 3. Urinary retention. 4. Excessive salivation. Answer: 3. Rationale. Atropine sulfate is an anticholinergic medication that causes tachycardia, drowsiness, blurred vision, dry mouth, constipation, and urinary retention. The nurse monitors the client for any of these effects in the immediate postoperative period. 378. A client with calcium oxalate renal calculi is told to limit dietary intake of oxalate. The nurse provides the client with a list of foods high in oxalate and places which items on the list. Select all that apply. 1. Beets. 2. Spinach. 3. Rhubarb. 4. Black tea. 5. Cantaloupe. 6. Watermelon. Answer: 1, 2, 3, 4. Rationale. Food items that are high in oxalate include spinach, black tea, rhubarb, Swiss chard, cocoa, beets, wheat germ, cashews, almonds, pecans, peanuts, okra, chocolate, and lime peel. 379. A nurse is conducting a health history on a client with hyperparathyroidism. Which of the following questions asked of the client would elicit information about this condition? 1. Do you have tremors in your hands? 2. Are you experiencing pain in your joints? 3. Have you had problems with diarrhea lately? 4. Do you notice any swelling in your legs at night? Answer: 2. Rationale. Hyperparathyroidism causes an oversecretion of parathyroid hormone, PTH, which causes excessive osteoblast growth and activity within the bones. When bone reabsorption is increased, calcium is released from the bones into the blood, causing hypercalcemia. The bones suffer demineralization as a result of calcium loss, leading to bone and joint pain, and pathological fractures. Options 1 and 3 relate to assessment of hypoparathyroidism. Option 4 is unrelated to hyperparathyroidism. 380. An 18-year-old client seeks medical attention for intermittent episodes in which the fingers of both hands become cold, pale, and numb, followed by redness and swelling and throbbing, achy pain. Raynaud's disease is suspected. The nurse further assesses the client to see if these episodes occur with 1. Exposure to heat. 2. Being in a relaxed environment. 3. Ingestion of coffee or chocolate. 4. Prolonged episodes of inactivity. Answer: 3. Rationale. Raynaud's disease is vasospasm of the arterioles and arteries of the upper and lower extremities. It produces closure of the small arteries in the distal extremities in response to cold, vibration, or external stimuli. Episodes are characterized by pallor, cold, numbness, and possible cyanosis of the fingers, followed by erythema, tingling, and aching pain. Attacks are triggered by exposure to cold, nicotine, caffeine, trauma to the fingertips, and stress. Prolonged episodes of inactivity are unrelated to these episodes,